Hello, everyone. Good evening. This is Dr. Sridhar, consultant nephrologist and renal transplant physician from Manipal Hospitals, Vijayawada. Today, let's have some interesting topic for discussion. Edema. Edema is a very common complaint by the patients. So, what exactly is edema? Patients complain of fullness in their legs. Some patients may complain of facial puffiness, especially around the eyes, that is periorbital swelling. And along with this, some patients complain of abdominal distension, shortness of breath, and some patients they may complain of distended veins in their legs. So all these are various complaints pertaining to the edema. There are n number of causes for edema. If we take from top to bottom, for example, if we take the heart, congestive cardiac failure, either because of a ischemic cardiomyopathy or dilated cardiomyopathy, valvular heart disease, or a pericardial effusion. So all these contribute to congestive heart failure, and in turn it leads to development of edema. And some of the patients they have chronic lung disease, which can lead to cor pulmonale and heart failure, and it leads to development of edema. Some patients may have chronic liver disease, that is end-stage liver disease, that leads to development of ascites, that is free fluid in the abdomen, and eventually edema. Some patients may have a chronic kidney disease leading to development of fluid overload state, and some of the patients may have leakage of protein in their urine that leads to hypoalbuminemia or hypoproteinemia, internally into development of edema. Some of the patients may develop abrupt onset of edema and decreased urine output, that is the glomerulonephritis. And in patients who are suffering from chronic illnesses, disseminated infections, terminal malignancies, they have hypoalbuminemia, and again they tend to develop this edema. Some of the patients who have disseminated malignancy, they have intra-abdominal lymph nodes which can compress the venous system or which can impede the venous return to the heart, eventually in development of edema in the legs. Some systemic diseases like hypothyroidism also leads to development of edema. And more importantly, varicose veins, that is the venous incompetence. In those people who have history of prolonged standing, they can develop this varicose veins, in turn leading to edema and venous eczema. So all these are various causes for edema. So what is a proper evaluation and treatment for this edematous states? So before starting treatment to any particular patient who is suffering from edema, it is very important to ascertain the causes. So the patient should visit his or her physician immediately. So usually apart from the clinical examination, the physician orders a battery of investigations in order to rule out the organ dysfunction pertaining to the heart, kidney, or liver and thyroid disorders. Once the underlying condition is identified, then the management points towards the underlying etiology. And in general, if you take for edema, usually the physician prescribes diuretics. The diuretics are of various types, but importantly, the loop diuretics and thiazide diuretics. There are two important uh, diuretics which will eliminate the excess fluid from the patient's body. Out of this, the loop diuretics are very, very powerful. Torsemide, furosemide, these are the two important loop diuretics. However, These diuretics should be prescribed judiciously because they have their own side effect profile in the form of hypovolemia, electrolyte abnormalities like hypokalemia, hyponatremia, hyperuricemia. Sometimes injudicious use of these diuretics for prolonged period may lead to development of hypotension, shock, and worsening of renal function. Sometimes they may precipitate development of hepatic encephalopathy in patients who are suffering from chronic liver disease. So these diuretics should be used very cautiously for a brief period with strict medical supervision and periodical assessment of the laboratory parameters. And apart from this diuretics, most importantly, the dietary sodium and fluid restriction. So in all the patients who are suffering from chronic renal failure or congestive cardiac failure or chronic liver failure, apart from the diuretics, many of the physicians prescribe fluid restriction and salt restriction. If this fluid restriction and salt restriction are not adhered, then even with the uses of diuretics, the edema may not subside. So apart from the medical management, this dietary restriction should be followed. And another important thing, the drugs, some of the drugs, they can lead to development of edema, especially antihypertensive drugs like calcium channel blockers and steroids, drugs like pregabalin, gabapentin, uh, some of the anti-Parkinsonian drugs, non-steroidal anti-inflammatory drugs, they can also lead to development of edema. So before starting diuretics in this group of patients, it is very important to come to a conclusion that the edema is not because of some organ dysfunction, but is due to a drug. So a trial of drug withdrawal initially should be attempted before prescription of the diuretics. So with this, I conclude my presentation. And so once again, I want to reiterate that edema is a very common but important symptom. And it has got n number of etiologies. And this edema should be evaluated thoroughly. And any form of treatment should be taken under strict medical supervision. And these diuretics should not be used as a over-the-counter medication. Thank you.